Well, good afternoon, everyone. We are here today because tomorrow all 4 regions of the Restore Illinois plan are eligible to move forward into the revitalization phase, or phase 4 of our Restore Illinois plan. With me today are 2 familiar faces to viewers of our COVID-19 briefings, IDPH Director Dr. Ngozi Ezike, who you've seen many times, and the University of Chicago's Executive Medical Director for Infection Prevention and Control, Dr. Emily Landon, whose advice, frankly, I have sought often, and she's been very generous with that advice, and I thank her for that. Also joining me are Carlos Nelson, the Chief Executive Officer of the Greater Auburn Gresham Development Corporation, who has made a career out of delivering meaningful community and economic development to our residents. The doctors and public health experts have reviewed the data and the proposed conditions for greater public activity and work conditions and have approved them, including the following activities with COVID-related health and safety guidelines. Health and fitness centers will reopen. Indoor dining at restaurants and bars will resume. Movie theaters, museums, and zoos will restore operations, and childcare and schools will reopen and expand, all in accordance with IDPH safety and health guidance. Starting tomorrow, hundreds of thousands more Illinoisans will be able to return to work. Moving to phase 4 this early was never a given. I've said since the beginning that data and science would design our path forward. And if any single region of the state were trending in the wrong direction in case positivity, hospitalization rates, or hospital capacity, we could not in good conscience offer that region the go-ahead to phase 4. We've seen what's happened in other states that have allowed politics or short-term thinking to drive decision-making. Many other states are now seeing significant increases in cases, hospitalizations, and intensive care bed usage, and they're being forced to move backward and stay at home. That's not the story in Illinois. Here, we have been gradually restoring business and leisure activities in a highly deliberate manner, guided by doctors' advice. And Illinoisans are following the mitigations that we can each do ourselves, like wearing face coverings, keeping 6 feet distance between us, and washing our hands frequently. As a result, we have significantly reduced our positivity rate, our hospitalizations, and ICU bed use, and we've seen dramatic declines in COVID-19 deaths. This is not to suggest in any way that our battle is over. But so much progress has been made, and if we continue to follow the path the doctors recommend, we can continue our march forward toward more normalcy. It's because of the people of Illinois that we're seeing a trajectory of success where other parts of the country are not. And I want to take a moment to tell you a little bit about that trajectory and remind you of where we've come from. Statewide, our COVID-related deaths per day are down 65% from a high 6 weeks ago. Even as our testing continues to grow, our COVID cases are down 76% from the trend's height 7 weeks ago. From a peak in the first week of May, the number of COVID-positive hospitalizations, including in the ICU, has dropped by over 60%. And we've seen a 67% decrease in ventilator use since reaching a high in mid-April. As we reopen so many businesses and activities in each phase, it's been important to watch the metrics closely to see if all the added activity would cause a spike in our numbers. That's what we did through phase 3. And the positive trends have continued while thousands of our small businesses in every part of the state have opened their doors again safely, as did our state parks, kids' day camps, and kids' summer programs. That's in large part because people have been wearing their face coverings in public and following other advice from doctors and scientists. I feel a solemn obligation to emphasize that we expect the journey ahead to be difficult. As more aspects of the economy open and more person-to-person interactions take place, there are many more opportunities for the spread of COVID-19. The virus hasn't gone away, and when people aren't wearing face coverings, gathering in large groups, and not practicing physical distancing, they're getting sick, and some are dying. And I mean people of all ages. Senior citizens, those who are in their 40s and 50s and 60s with pre-existing conditions, and yes, even young and perfectly healthy people have lost their lives to this terrible new disease that we still know so little about. That's why I'm not afraid to protect the people of Illinois by moving a region back to an earlier phase if we see a surge. Ours will not be one of the states that takes no action in response to a return to the peak. Until we have a vaccine or effective treatment, our core pillars for safely moving forward remain the same. Widely available testing, extensive contact tracing, and widespread use of face coverings and social mitigations by everyday Illinoisans throughout the state. On testing, today we hit an important new milestone by surpassing 30,000 tests in a single day for the very first time. Continuing to grow our daily testing in this next phase has required a newly aggressive approach, one that makes our state a national leader in flexible testing to meet the demands of a more open economy. We're in the process of launching 12 mobile community testing teams that can be moved anywhere in the state to mitigate and suppress emerging outbreaks, including places like meatpacking plants, nursing homes, or other traceable gatherings. These mobile teams operate in partnership with a network of commercial labs that we've contracted with on a regional basis, allowing the delivery of results on an expedited basis. On contact tracing, we continue to build up our capabilities, including new hires that have increased the ranks of contact tracers already by 20% since June 1st, for a total of 550 active contact tracers so far across the state. 250 additional new tracers have been identified and will join their ranks over the next few weeks as we continue to scale up our operations, including new technology to multiply those new tracers' effectiveness. All 97 of Illinois' local health departments are participating and have applied for funding supported in total by $230 million for an increase in contact tracing. That money is on its way out the door, with final disbursement coming in the next few weeks. And because it's critical that we reach all our residents through every means possible, next month, community-based organizations will have the opportunity to obtain funding through IDPH to collaborate on contact tracing efforts alongside our public health departments. Of course, most important to our ability to minimize outbreaks is the efforts of everyday people to do their part. And to date, Illinoisans have reduced the rate of spread in their communities extensively. That's why we've seen the trends that we have and that have cautiously moved us through the Restore Illinois plan. As we move forward, it's critical that everyone continues to operate with those same mitigations. That means maintaining 6 feet of physical distance, washing our hands regularly, and crucially, wearing a face covering when in public places. Illinois required face coverings in public at the same moment that we began to slowly open more things up on May 1st. Since we implemented that one change, we saw all the numbers stabilize and then begin to fall. And in just the last week, we've seen other states like California and Washington following our lead in requiring face coverings. As we enter this new phase, we will be looking to adjust our plan over time as the data and science allows. If we see stable numbers over the coming weeks, we can then consider additional modifications to the framework of Phase 4. The goal here is to move ever closer to a restoration of activities and business that can be done in a safe and healthy fashion. The philosophy that got us here has been a successful one. Prioritizing public health and watching the virus rate of spread, our case numbers and positivity numbers, our hospital capacity. But any pride in our success has to be tempered by grief. Over just a few months, we have lost over 6,800 of our fellow Illinoisans to this virus. Today, we lost 41 more. May their memories be for a blessing. Many of our residents have lost someone that they love, a family member or a friend, to this virus. I know I have. This pandemic has brought real tragic pain to the lives of countless residents, and amidst renewed calls for racial justice, has disproportionately taken Black lives and caused disproportionate economic disruption in the Black community. As we take our next steps forward, and especially as we begin to safely reopen meaningful swaths of our economy, we have to continue to look out for one another. Our number one priority must be the health and safety of workers, families, and all of our state's residents. Illinoisans have demonstrated their commitment to that priority in countless ways. Let me highlight just one. Today, the Illinois COVID-19 Response Fund released its fourth and largest round of funding so far, nearly $7 million to over 40 nonprofit organizations all across Illinois, bringing its total impact to over $23 million so far, that has reached over 800 organizations statewide. This incredible effort is made possible by the more than 3,100 donors willing to give to their neighbors in these trying times, and by the vast network of nonprofits and volunteers who are on the ground serving families and helping them stay on their feet. This pandemic has brought so much hardship to so many, but through it all, the people of Illinois prove themselves to be the kindest and most generous in the nation.